morning, good afternoon, and good evening to us all. We are really privileged today to be talking with Professor Alex Mihailidis. And I'm quoting from one of the articles that I had the pleasure to read. Quote, "But from a research perspective, I learned that we have done an awful job of translating our research to the clinical world." Alex and I go back more than a decade. I've known of the work of Alex and Age Well for many years, but I do want to put in context, that comment by enabling him to tell a little bit of his story. But before I do that, let me just tell you, his qualifications and who he is as one of the leading professionals in the field of technology in the world. Alex is Associate VP for International Partnerships at the University of Toronto and the Scientific Director of the Age Well Network of Centres of Excellence, which focuses on the development of new technologies and services for older adults. He is also Professor in the Department of Occupational Science and Occupational Therapy and in Biomedical Engineering, with a cross-appointment in the Department of Computer Science. As you would imagine, Alex has co-authored and authored hundreds of journal articles, presented hundreds of conference papers and abstracts in this field. He's very active in the rehabilitation engineering profession, currently as the past president for Rehabilitation Engineering and Assistive Technology Society of North America. And he was awarded Fellow of RESA just in 2014, and it's one of the highest awards for his work in research and practice. AgeWell is a very unique Canadian network that brings everyone together to develop technologies and services for healthy aging. I omitted to let you know that Alex, like myself, is also recognised as being one of the Healthy Aging 50 by the World Health Organization. Now, Alex, perhaps you can just tell us a little bit about who you are and the work at AgeWell, and then I want to take you back to September 2019.
Sure, and thanks very much, Jane, for inviting me. And I recall, I think one of the first times that we truly met and had a good time to get to know each other was a around the world trip that we were doing. We were jumping from conference to conference together and spent a lot of time on airplanes. So I'll never forget that trip when we got to know each other. So yes, as you said, Alex Mihailidis, I've been a professor at U of T now for University of Toronto for 19 years now. It seems like it's gone by very quickly. And during that time, I am the scientific director and CEO of AgeWell. And AgeWell is a cross Canada network. We've been around for approximately 13 years now. During that time, we have grown quite dramatically. We have over 1,000 researchers and trainees, 450 partners from industry, government, not-for-profit sector. And during that time also, we've trained over 1,000 master's, PhD, postdoctoral fellows, as well in the area of age tech or technology for older adults. And perhaps the most impressive stat, or the one that I'm most proud of, is we have actively engaged more than 5,000 seniors and caregivers as true partners in all the research and work that we're doing in the network. And we funded research from anywhere from the development of apps to the development of social robots to go in the homes of older adults, smart home systems, artificial intelligence, and autonomous vehicles. So quite a wide range of work that we've been doing. And I think just the sheer size of the network and how quickly we have grown has just shown the massive gap that we've had here, at least in Canada, in the area of technology and aging. So we're quite proud of being able to fill that gap and hopefully many more years coming up.
So Alex, one of my roles way back was the chair of the Standing Selection Committee for the National Centres of Excellence. And that's where I really got to understand, talking with you and your colleagues, about your work and the application and the tenacity in which you pull through the voices and also the experiences of seniors. But And I thought you were excellent then, right? And I'm a strong advocate of age well, but something happened to you September 2019, which appears to have changed the way that you think about your work. Can you just share a little bit about that?
Yeah, it was Labor Day weekend here in Canada, and we are up north at our cottage as we typically would be, and our cottage is on an island about on a lake about 3 hours away from Toronto. And my son, who at that time would have been 8 years old, was off climbing around as he typically does with his friends, and he got stuck up on this cliff, and I could hear him yelling for help, and I went down to see what's happening, and he was clearly stuck and starting to panic. And so I climbed up and got him safe, but unfortunately the ledge I was on out, and so I came down about 40 feet. And that resulted in some fairly severe injuries, including an incomplete spinal cord injury, to which I still live with this day, but it also broken pelvis and various other things. Long story short, I ended up being in hospital for 4 months. But the more important part of this story is I was in the same hospital in which I was or still am, a research chair. And, I'll never forget that first day when my physiotherapist came and got me from my room and helped me transfer into my wheelchair because I couldn't walk. I had to relearn how to walk during that time, and was pushing me into the physiotherapy gym, and all of a sudden stopped and said, "Hey, is that your picture on the wall?" And very sheepishly, I said, "Yes." And she's like, "Oh, well, why is that?" And I said, "Oh, well, I'm a research chair here." And she's like, "Research? I didn't even know we did research at this hospital," which is funny because there's a research lab in the basement of the hospital I was in that developed technologies for rehab. And so during that time, as more of the care staff, the nurses, the doctors found out kind of what my position was there, a lot of times the conversations ended up being nurses just sitting at the edge of my bed and me telling them about the work that the hospital has been doing for decades in the area of rehab technology, many technologies which could have helped me personally, including the ones developed in my own lab. And it just right there, it just dawned on me like, wow, what a really crappy job we've done in terms of letting people know of the technologies that are out there, maybe not just for older adults, but for anyone going through this process. Particularly, if people are in our own hospital who are delivering these services and care do not know what we're doing, then, how bad is it then outside of that hospital? And it was kind of at that moment where it kind of just dawned on me that, I spent a lot of my career up to that point, almost 25 years developing technologies and trying to commercialize them, et cetera. And just realize, what, the rest of my career needs to be spent on the knowledge translation side, the policy side, really kind of almost, plowing the road, so to speak, for those coming up behind me, particularly, my students who are far smarter than I am in the development of technologies. But where I can play a role now is really advocating for ensuring that we do a good job in telling our stories and hearing the stories of others. So it was a life-changing moment. I say life-changing moment, obviously for me, for my wife, for my kids, for my friends. But it was a life-changing moment for me as a researcher.
Alex, I think that you shortchange yourself in terms of the extent of your injuries. It's very public knowledge that the extent of their injuries were such that, several times we almost didn't have you, at the Global Cafe. You were intubated, you had to learn, but you also went through very lows, in your mental well-being. And I think as a researcher, and people in our field who are advocates, I think when that really touches you, it really does change the way that you think about the world.
Mm-hmm. Yeah, no, it was a very tough time. I've always had anxiety in my life, but during that time, my mental health really took a nosedive, right? And in a way, it was actually a blessing because I finally was diagnosed properly with anxiety disorder, and at that point, depression, et cetera, and getting it treated properly to this day, which I think has helped me obviously as a person and as a researcher. But Jane, and the researchers out there, it's hard to divide the researcher from the actual person, right? And so, what I live in my everyday life bleeds somehow into my research world as well. So even now, living with an incomplete spinal cord injury, I have no bladder, no bowel function. I have to do certain things, obviously, to keep things going every day, and always thinking about how could these things be done better, and again, whether it's from an environmental design aspect, whether it's from an assistive devices aspect, et cetera. And it's interesting because I just had a doctor's appointment last week, and to talk about these issues, and I actually said, I'm not worried about now. I'm worried about when I get older. As I age with these disabilities, it's going to be harder for me to do these things and to care for myself. So again, that has me thinking about, now this whole era of aging with a disability, which is not unique to me. This is a very common thing, whether it's a spinal cord injury, arthritis, or something else. And so, how that's actually impacting age well is I'm dropping this whole thing of you're old when you turn 65, right? We're all aging. It's a life course approach here. And as I continually say, if you're not aging, you're dead. And so age well as a network, when we talk about technology for aging, that technology needs to be starting to use early in your life, and start to make it integrated in your life as you move forward. And that's really what I'm starting to push now at all levels, including with government, with really, Jane, anyone who will listen to me. So it really has changed my entire approach to this.
We had a person, an expert, Colin Lowe from the Design Aging Institute last week, and he said, I start off being polite, and then I shout, and then I'm just completely disruptive. So I think that you're bordering on the disruptive like me.
Yeah.
I think it's also important to say that throughout your time in hospital, you continued to work. And I think, that then just speaks to people like you and I, that balance is, I am who I am here and in work and outside. And I think that's the case when you're so passionate, but you actually, without your voice, that's one less voice to advocate for change.
Yeah, no, absolutely. And so apparently I was sending emails while I was in the ICU, which, according to the recipients, didn't really make much sense. But my work saved me, from a mental health perspective. And that's another thing I realized, and that I'm looking now when we look at long-term care is, you have your half an hour of physio, you have maybe an hour of programming, spend 45 minutes in the gym, and then the rest of the time, there's nothing going on. You're literally sitting there doing nothing, And so the fact that the university here in Agewell allowed me to keep working was a lifesaver for me from a mental health perspective. I think, things would have been a lot worse if I didn't have that. And yeah, there were some awkward moments, when I'd be sitting in the front cafe in my wheelchair, and someone I knew would walk in there and they would say, "Oh, are you here for this meeting?" And then they would look down and see me in the wheelchair and realize, "Oh, you're here in a different capacity." But again, that capability to keep working, to stay involved, was truly one of the key lifelines I had during that 4 months.
So let's now sort of shift to, talking about some of the technology. AI and robotics, quite frankly, worries me. Is it going to replace, the human touch that we so desperately need in this technological world? So how do you see AI?
Yeah, I have the same worries in terms of what that balance is. And that is why, whenever we talk about any of our technologies, it's always, this is a tool for the caregivers to use. It is not a replacement. However, Jane, that thought has changed a little bit in my mind, and especially looking at things like long-term care or institutional care, where we all know you go into one of these facilities and the staff is just run ragged, and they're run ragged doing the things, getting people up, getting them dressed, feeding them, medicating them, making sure they're safe. And because of that, there's no time or opportunity for them to have that social connection with residents. And so it's been interesting that in the use of robotics and AI, a lot of people focus on, okay, well, how do we use robotics to, play bingo with the residents, or to sit down and have a conversation with the residents? And we really need to flip that, right? The robot should be doing those tasks like the laundry and everything else that taking the social time away, so that the caregivers and the staff can sit down and play bingo with the residents and have those social conversations, right? So I think in some cases it'd be great if we can replace the staff in those more lower level activities, which are still so important, but are really taking the time away from having that social aspect. So I think, again, that's one of the things that we're trying to advocate for within AgeWell, is to look truly at the activities where staff do want to have a replacement or a tool that they can be using that frees them up to do things that they want to do, and that they know will make a big difference in the lives and the quality of lives of the residents of these homes, or even people living in their own homes as well.
Alex, I just want to take us back to AgeWell for a minute. Now, 13 years, there's been development of, products and innovations and extraordinary expansion of trained professionals in this field. Now, how do we get some of these to market? Because that's the sticking point. We've got brilliant minds, we have products and technologies that really will enable, and yet, it's this missing piece getting them to market. Yeah. How does this happen?
Yeah, so in my mind, there's two missing pieces actually. So we are great at developing the technologies, and we have some fantastic technologies in the pipeline. What we're not so great at is understanding the policy and the regulatory piece, and understanding the service delivery piece. And if you almost imagine those three things, technology, policy, service delivery, as overlapping circles, the sweet spot is right in the middle. That's what we need to be doing. And that's where we need enough funding to do, et cetera, in order to move these things out. And that's really, again, what we push within AgeWell. To do that, we need policymakers to understand the role that technology can play. And while the pandemic has been an awful thing, as Winston Churchill, once said, never let a good crisis go to waste. It has given the opportunity to really open the eyes of policymakers that, oh, hang on, technology could have filled a lot of the big gaps we saw during the pandemic. And so we need to take advantage of that, and I think we are. The service delivery models is still a big one. And what we're starting to see, though, are companies like Best Buy and other big box stores coming on board saying, hey, well, we could sell these technologies in our stores, and we can train some of our staff to work with consumers, whether it's the older adults or the families or whoever, to understand what type of smart home system will work for them and how to install them and maintain them. And so, again, we're at this very important moment of time, I like to describe, where finally we have the policymakers on board. Finally, we're starting to see other markets as opposed to traditional healthcare systems really becoming involved in the distribution or wanting to distribute these types of technologies. The final missing piece, as we all know in all this, is money. And in AgeWell, we are really trying to push that to create further investment from the government, not just in AgeWell, but in other networks that are doing similar work. And the biggest thing we're working on now is developing, finally in Canada, an impact fund that will be significant enough that it'll be able to invest in Canadian startups to start off in Canada, grow their business, get into the marketplace, and then benefit the rest of the world as well. So hopefully in the next 12 to 18 months, we're going to see some significant announcements and changes in this particular area.
Now, Alex, AgeWell has been particularly successful in the relationships with the private sector, as well as with, civil society and government. You have this really cross-sector, cross-discipline approach, which IFA runs with also. How difficult has it been to get this balance? Because each sector has a different language. Yep. So how have you been able to actually develop the patchwork quilt that makes sense to everybody?
Yeah, it's been a big challenge. To be honest, the developing relationships with industry was not that hard. The business case is there, and we can show the business case. And once they see that, we tend to get a lot of buy-in from industry to be part of this. The tough part was with the policymakers and government. It took us, I would say, 9 years finally to be invited by the government to the table where we can talk about the role of technology. And since then, things have grown. And so now AgeWell is one of the primary consultants to our federal Minister of Seniors. AgeWell, we finally were able to work with the federal, provincial, territorial ministers responsible for seniors to bring them together at one table to talk about technology and to support older adults and caregivers. So we're starting to finally see some momentum. It did take a long time. My worry is the election cycle is going to run out on us and we're going to have to start all over again. As you know, that happens in government. So again, now's the moment for us to take advantage of this and to really, really push hard. And again, not just as AgeWell, we want to bring together all of our partners, such as IFA, such as, CanAge and other organizations around the world to really start to pull in the same direction now when it comes to this particular field.
Alex, for those that don't know, when we talk about federal, provincial ministers around the table, it's not just picking up the phone. It really takes an enormous strategic understanding and effort to bring governments around the table. So I think that's certainly worthy of note. The other thing that I've really noticed with AgeWell and you and your team, and I talk about you, but really, you have developed and fostered, this team, globally recognized, the way that you look at function, right? And it's always, IFA's shtick to talk about function rather than spinal cord injury or MS, or it's about how do we create that. And I know that you have partnerships with the Frailty Network. So how does that relationship work and where does function fit into, or is it mainstream?
Yeah, you're right. It comes out of function, it comes out of participation. And that's the ultimate goal of what we're trying to do, is to have people to be able to participate in their own lives in the way that they want to do. And that's whether you're still living at home, whether you're living in a retirement home, or if you're living in a long-term care home. And so, the partnership, for example, with the Canadian Frailty Network is really, really important, because frailty is one of those things that people think is part of normal aging, but it's not. And we can help to prevent people from becoming frail through a variety of interventions, where one of those interventions can be technology. And whether that's technology that helps people to complete various exercises, to encourage them to get out and get walking, to eat properly. And so, it really was a natural fit between our two networks to be working side by side when it comes to this. But again, looking at technology not as the silver bullet, but as something that works alongside the many interventions that the Frailty Network has also developed. And how do we see these integrated from an intervention perspective, a policy perspective, and again, a service delivery perspective as well.
And, I certainly concur with your relationship around frailty not being the norm, but the perception that it is the norm. So I'm just going to stop chatting for a minute and call on questions. And I have a question from Shmuel. So thank you, Shmuel, for being with us today, every week, in fact. So you're a regular, so thank you. Shmuel really wants to talk about the revolution of technologies like Zoom. And to what extent, can we see, a transformation and aging? Is there a Zoom 10.0 coming down the track? What is that going to look like for us? And it's not about the connection, it's about the engagement. What are your thoughts about that?
Yeah, I think, with what's happened over the past 2-3 years of using tools like Zoom has been less about the technology platform itself, but more about the demonstration that we can actually use these tools, and older adults can use these tools. I'll take my province of Ontario as an example, and Jane, you'll know this, that it's taken us decades to try to get telehealth in this province, and it always failed. But instantaneously over a weekend, we also have telehealth, and we have people using Zoom to talk to their doctors, and it worked. And we see it working with older adults. My parents as an example, who are both in their mid to late 80s. And so I think now that we've seen that this model works, we're going to start to see more of it happen, more of it being part of the service delivery of healthcare. And we're starting to see now a lot more startups in the area of age tech or technology for aging that are working on these types of now online platforms. And whether it's a Zoom-like platform that's being changed and modified to take into account the specific needs of older people, to new tools that are integrating their care circles, etc. So I think now that people know that it works, people are going to be using it more and more in the technologies that they are developing.
So Alex, how long does it take from go to woe to get something to market? From the point that you are, because I don't think that we really understand. It's just not 6 months.
Yeah, so if you go by research, which is fairly good research around this whole innovation cycle, from the moment we start the idea in our research lab to getting it out there and having impact, the estimated cycle is 18 years, right? 18 years in a tech field makes no sense. If you're 2 years out, you're behind. So this is something that we're really trying to work on as well, is how do we speed up this process without cutting corners? And cutting corners typically starts at, okay, well, we won't talk to as many people about what the product will be, and that will lead to a disaster. So again, it's really trying to help to build new design tools to teach the new generation of the designers of these technologies, that is the students right now, even right down to the high school level, we've been doing this work on, again, how do you get information as quickly as possible? How do you talk to older adults, take that information, synthesize that, and go forward? And the whole notion of failing often is key in the entrepreneurship world. but failing fast is also important, right? We need to learn, especially as researchers, we need to let go of our ideas much quicker than we do, and sometimes they're like our children, right? Our ideas in the research world. Sometimes we just need to move forward and move on in order to get to the right solution. And so hopefully we're going to start to see that cycle get a lot quicker, and getting big companies involved that have the capabilities to do these things and to work with us are going to be critical as well.
Yeah. I want to turn to standards. I've been beating the drum, as you have been, around the inequities, across Canada and in many countries when it comes to the care and the service delivery in long-term care settings. And it's no longer acceptable to say, well, 80% of those that died in the pandemic were in long-term care. Yeah. Sorry, that's not an excuse, and saying that we must do better for seniors is just unacceptable. So talk with us a little bit about your work in the development of standards, because I think that's a very unique part of your role in Canada.
Yeah, so about 2 years ago, I was approached by the Canadian Standards Association, or the CSA group, and they develop standards, anything from bike helmets to electrical implementations in construction. They also have standards around healthcare facilities, but what they don't have is a specific standard on long-term care homes. And so they approached me to lead the development of a standard that generally was around infection prevention and control. And when they first invited me, I just thought about, this is just going to be about heating, ventilation, air conditioning. It's going to be about, electrical systems and things like that. But they promised me that I would have as much leeway as possible to include things around the social factors as well that would be important in these types of standards. And that's exactly what we did. And so we developed a standard over the past 2 years that will be coming out, I think, in the next month as the final version, that not only talked about, things like heating, ventilation, et cetera, air quality to prevent the spread and transmission of disease, whether it's another pandemic or influenza or whatever else, but also took into account the social ideas and factors of, design of people's bedrooms, design of social spaces, design of the kitchen and the meal area. And for example, we consulted with many of our leaders and elders in our Indigenous communities to understand, well, how do we include their cultural practices into meal preparation and meal sharing, while at the same time ensuring a safe environment if there was to be an outbreak like we saw. We talked about socialization and how to maintain social connectedness through the use of technology, again, if there was a pandemic. And, Jane, we both know, and others know, that social isolation, and depression was probably one of the key factors in many of these deaths that we saw. And so, we developed a standard that was holistic in my mind, that took into account these different cultural practices. We even talked about sexuality and the acceptance and equity across different types of sexuality and choice in sexuality and gender. And again, how that may impact the design of these homes. And so it's actually a standard that I think will be seen as different than what's out there. One of the big things is typically you have to buy these standards. CSA Group has agreed to make them available for free of charge, because we know it's not going to just be the architects and the builders reading the standards. It's going to be families of the people living in these homes. But going back to your comment before about working with federal and provincial governments, long-term care is not federally mandated in Canada. It's up to each province and territory. So we have to get buy-in from every province and territory. And I remember making those initial calls to get people around a table, and a couple of our provinces already saying, well, thanks, but no thanks, we'll take care of our own, which they didn't. So now, yes, it was a lot of work to develop the standard, but in my mind, now the real work begins. And so I'm already planning a road trip coast to coast to coast to convince builders themselves and really kind of get a ground up, from the ground up kind of swell of support that gets to the point where our governments really have no choice but to mandate these things. So, but it's been an interesting process, one I've never done before, one that I'll probably never do again, to be honest with you. But this one was so, close to me. Again, not just because of the work I do, but also my own personal experience of essentially being in a long-term care facility, and seeing how things need to improve there.
You always make such compelling arguments on a scientific level, but also a personal level. We as the collective across industry, across disciplines, across other sectors, including NGOs, need to get behind this, because standards that are not mandatory means that it gives governments and providers an out, which then means that there is inequity and discrimination. And so someone is going to miss out. And so, from an IFA perspective, you've got our support, and we'll talk afterwards. But there needs to be this groundswell that goes with you for this to be legislation. And, we've talked about the jurisdictional responsibilities, and, aged care, long-term care is not federal. However, when it impacts the livelihoods of seniors in every single province of this country, it seems to me that there could also be a continuing level of noise that's exacerbated across the time. So I just want to go back to Marjorie Willison. And Marjorie is really making a comment, but I'd like to see if you've got an example about the direction of technology to help replace routine staff. Is that happening anywhere in the world? Are there examples?
Yeah, so let me actually start from a different industry. So I was in Korea last week, and ordered room service, and what delivered my food to me but was a robot, right? So it wasn't a person that had to physically carry the trays and everything else. It was a robot that came up to me and delivered my food to me, and then came back and took the tray away. Why not do the same thing in long-term care homes, where that kind of delivery of the meal trays, et cetera, can be done by robots, again, hence freeing up the time of the staff to actually sit down around the table and share a meal with seniors, right? In terms of research in this area, we are seeing some examples now of these types of service robots being used in hospitals and long-term care homes. So, there's an example of a project in Agewell with a robot being developed to, take out the dirty laundry and to carry that to the, to the washing machines and take care of that kind of activity. So, we're starting to see it. It's far more prevalent in other industries that we can be learning from. And especially in long-term care homes, where these are people's homes, right? The hospitality we should be providing, the hospitality services should be as high, if not higher, than what we see in hotels, right? And so we're looking at other industries. We're trying to adopt those technologies. We're trying to bring those companies into the healthcare space, and actually many of them are quite excited to do that. So, I think it's those kinds of activities we can start to see where there's more automation in the process.
Just look, thank you for that. And I can hardly wait. There's a robot to walk my dogs. So I think that's going to be a real.
Also, a robot was delivering my Starbucks to me.
Look, I'm on this. But I also want to chat with you about the Healthy Aging 50 and the decade, and how can you see the role of Agewell in furthering the action areas of the decade? What does that mean to you?
Yeah, I think that, and first of all, it's a great honor to be named on, and congratulations to you as well, Jane, for being named. It's a great responsibility given to Agewell to really take now the global lead when it comes to technology, and to advance, the directives of this healthy aging decade. And again, really to show that technology can play a role side by side with the other interventions and the other approaches we have in the care of older people. And so, AgeWell, we're taking this very seriously. We are, our status as a network of center of excellence in Canada has come to an end in 2024. We don't see that as a liability. We actually see this as an opportunity where we can now do things on the international and global level that we weren't able to do before, and bring in new partners and really work hand in hand with IFA, WHO, and others to really start to move this mandate forward well beyond Canada. And so we're really excited by this opportunity where, we already have buy-in by many partners around the world to be working with us. And so, we're going to take this quite seriously and really help to move the dial. And as I said, now's the time to do it. All the stars are aligning, so to speak, for us to be doing this, and we're going to really jump on it.
Yeah, look, and IFA also, because IFA is really interested in actually building the bridges across the technical unit, WHO, the Information and Technology Society, and aging and health. What does that mean? And also the development of metrics in long-term care. What does that mean? And while it's important that WHO builds the metrics, more importantly is that, Age Well, yourself and your colleagues inform those metrics and then are part of the incubator to test the metrics. So I think that's going to be, an important step in the development of the decade.
Yep, absolutely. Absolutely.
So Mark Venning has just put in the chat box, ISO standards. So tell me the difference between ISO standards, and the standards that the CSA has been developed. So, because where do people go when there's, we need standards?
Yeah, it's a very messy landscape out there. And so thank you, Mark, for putting that, and also for the Standards Council of Canada webpage in the chat there. So ISO standards really look, at that international level and try to take into account the various factors across different countries and regions, whereas the CSA standards is very much about Canada, right? And CSA is not shy to say, we're about Canada, the Canadian context, and that's what we focus on. The key thing here is informing each other. And we did look at the ISO standards to inform many things in our own standard so that we can be aligned. Because this alignment and partnership across different standards organizations is going to be really, really critical. So even here in Canada, there was a second standard developed by HSO, or Healthcare Standards Organization, led by Dr. Samir Sinha, who's a world-renowned geriatrician. And his standard was really more kind of about the care itself. And so even there, we have to make sure that we dovetailed very nicely, because, if their standard is saying, well, this is the type of care that needs to be provided, and our standard does not provide the environment to provide that care, then again, things are going to fall apart. So the coordination between the standards organization, something that needs to continue to happen, not just in care standards or infection prevention control, but there is no standardization when it comes to technology. What we develop here in Canada in terms of technology, if you just think about the types of inputs and outputs the technology may have, it's going to be very different in different countries. So for us to take a technology built in Canada and to bring it to Australia, to bring it to the UK, to bring it to Africa, it's not going to work. And it's going to take a lot of redevelopment and time and money to do that. And again, that's because there is no coordinating body when it comes to this. ISO has tried, and I appreciate the efforts they put in, but again, it comes down to adoption. It comes down to everyone getting on the same page. And sure enough, every conference I go to, there's always that one hand that gets raised, and the person says, what we need are common standards for the types of sensors we use in age tech. It happens, I've heard it for 25 years. No one had been able to do it. And again, I think now we're at that point of time where with leadership from organizations like AgeWell, IFA, WHO, ISO, CSA, FDA in the United States. Maybe now we can finally get together on one table and decide upon this.
Yeah, I love those questions too. All right, so they're usually about, do you think ageism is a problem? So yeah. So Mary Shipp, would you like to come forward and ask Alex your question?
I think technology can be a very big advantage to many of us, and we've learned how to use Zoom and other technologies in the pandemic. But the problem in many parts of the world is that they don't have access to technology or the ability to use it. Is there a good way to try to attack that problem?
Yeah, thanks, Mary, for that question. And here in Canada, it's not just outside of our borders; it's in our own backyard, right? You look at the pandemic. Many of the long-term care homes didn't even have Wi-Fi or internet for them so that their residents can use a tablet to connect to the outside world. Many of our Indigenous communities do not have simple cellular connection, and therefore the technologies are useless for them. And again, this is a problem that we see repeated around the world. So the whole notion of equity and will technology kind of increase that inequity is a big concern of everyone, at least in AgeWell and the work that we're doing around age tech itself. And so the question is, how do we start to develop these technologies so that they can be replicated using the resources that are available in a specific region? And that's something that we're looking at in things such as robotics and even things as complex as exoskeletons, right? So robots that you may wear on your leg to help you with a disability. How can we build those types of robotic devices, again, just with the resources that are available within that region? But at the end of the day, this inequity is going to exist until everyone has access to the internet, has access to solid cellular service. And once that happens, a lot of these inequities hopefully will start to fall, because that's really what we need for many of these technologies to work. The other thing obviously is cost. A lot of these things are still very expensive. And 5 years ago, if someone talked to me about robots, I would say, forget it. These things are hundreds of thousands of dollars. But, in the past 5 years, we've seen robots go from hundreds of thousands of dollars to hundreds of dollars in some cases. So, the technology will take care of itself when it comes to cost. But the resources and the infrastructure, that is the duty of our governments. It's the duty of our policymakers and of the companies out there that provide these services. And Canada stepped up and said, well, every community will be connected with the internet by 2030. That's way too late, man. Like, why? This should happen in the next 2 years. And so we really need to continue to push our policymakers when it comes just to these basic things. Access to the internet is no longer a luxury. It's a basic right. And that's the way it needs to really be seen.
And, once again, perhaps there's a time then that we need to get different players around the table.
Yeah, absolutely.
Civil society to drive these key messages as part of the contribution to the decade. So I've just got one more question. Okay. Goodness me, we're getting a couple more questions. So I'll go back to the two questions. Sabby, would you like to come forward and ask Alex your question?
Okay. Hi. Good morning. Thank you so much for your presentation. I cannot tell you how amazing it is. I've been working in the field of the older person since I was 29. I've written a book called Elder Abuse. You have a role to play, and everyone has a role to play in addressing the world of aging. But aging is fun. It's exciting. We don't need to look at it from the perspective of negativity, but we all need to be at the table to have those conversations. So at the moment, I'm working with an IHA, which is Innovative Housing Alternative. And what we've done is we've dissected the retirement home model in order to provide housing for the older person. But we cannot do it. Housing and technology need to fuse together. And we want to be part of the solution with respects to that. But from a developer's perspective, sometimes it's hard to get to the table. So
Okay.
how can we do that?
Okay, thanks, Abby. And Alex, I'll just take a question from Anne-Marie, and then we'll ask you to respond to both. Anne-Marie, thank you, Abby.
Good morning, Alex. Thank you so much for your presentation today. My question really relates to something earlier that you referenced in this concept of moving the design process around aging earlier into our thinking. Today, we often design around aging as a problem, something that has to be fixed, whereas so much of the global stage and the design work is being done to look at aging much earlier. We've always loved your expression, if you're not aging, you're dead. So I just wondered how some of that, what I call newer, fresher thinking, is being baked into the design and research process.
Thanks, Anne.
Yeah. Oh, sorry.
No,
Go ahead,
you go, Alex.
Yeah, so to answer the first question from Sabi, I put in the chat the link where you can join the AgeWell network. So I think that's step one is join our network, get involved, and we'll work with you in terms of any specific projects or directions we can be going with. To answer the second question, it is something that's an ongoing process to try to have people understand that this is a lifelong process, and that the technologies that work for older people work for children, it works for adolescents, it works for your parents of young children. I use the same technology with my 80-year-old parents I use to help remind my children to do various things, right? But it is going to take some time to continue to change that mentality. And the way we're doing that, at least within AgeWell, is through our training programs, right? So again, we've had over 1,000, trainees go through our program. And in that, we try to teach them about the life course approach in this whole thing. And that, again, aging doesn't start at 65 or 55 or whatever else. So that's kind of the first way. The second way, again, is from a policy perspective and kind of a social aspect of just getting people over the idea that, when you're 66, you're an adult, and when you're 65, you're an older adult all of a sudden for some reason, and get that number dropped, right? Like it's, right from a societal level to the type of work that we're doing.
Yeah, and Alex has just put in the chat box where to join AgeWell, and I encourage everyone. One last question from me. Alex, you alluded to, or you didn't allude, you said that 2024, the status of, the National Centre of Excellence AgeWell, will change. What's the future? I want us to be really clear that there is a future, and what does it look like?
Yep. So the future of AgeWell is going to be focused on 3 pillars. It's going to be on innovation and entrepreneurship. So that is actually getting these things out there onto the marketplace. The second is going to be on training. So still training the future leaders. And I'm not talking about academic leaders, training the future leaders that'll work in government, that'll work in industry, and will also work in academia in this area. And then the third pillar will be research. So continuing to fill that pipeline. And kind of wrapping around all this is the notion of, equity, diversity, inclusion, which would be key factors in what we're doing, and changing the minds of policymakers as well as we continue to go forward. And, slowly but surely, we are cobbling together funding for each of those pillars that will keep us going here in Canada and internationally as well.
Well, IFA looks forward to be part of that. Now, just stay
Absolutely.
with. So I'm just going to introduce the speaker for next week, and then I'm going to come back and ask for the takeaway messages. It will be my great pleasure to moderate a really interesting conversation with a great colleague, Professor Ross Upshur. Ross was with us probably in the first year of the pandemic, and he talked about ethics, and there was a lot of demand to have Ross back again. So please join with us and be in conversation with Ross Upshur on public health ethics as a flagstaff for change in long-term care. So Alex, you know, you really have, you've really given us some insight into you, Alex, as the person, and you, Alex, as the academic, but you, Alex, as the visionary. I haven't talked and listened to you for quite some time, but there has been some serious and dramatic changes in the person that you are. And that's not only come out through the work that you do, but the conversation that we've had. I feel very privileged and honoured that you've been able to share, you know, your personal perspectives, you know, the real life experiences that have actually created and shaped the change that's happening, you know, in Age Well. So could you take us out with this Global Cafe with some key takeaway messages?
Yeah, sure. Let me first say, you know, next to Jane, Ross Upshur is one of my favorite people in the world. So I'm going to tune in for that one because I love listening to him talk. In terms of takeaway messages, you know, here is first and foremost, there is a role for technology. You know, I think we have seen that. It is growing. We've seen examples of where technology can play a role to fill many of the gaps in our healthcare delivery models right now around the world. Second takeaway, though, it's not a replacement. You know, we still need those caregivers. We still need that human touch. Technology is one of many tools that caregivers, whether it's family caregivers or paid caregivers, can be using to help do a better job in terms of providing the care that everyone deserves as we grow older. You know, maybe the final takeaway I'll say is, you know, this is, you know, the whole adage of it takes a village is absolutely true. Age Well, we can't do this alone. You know, we need the IFAs, we need the WHOs of the world who may not be technology organizations, but have other capabilities, expertise, connections that can help to move us all together in a very holistic fashion. And doing that together and doing it in a way where we're making sure we're telling our stories about what we're doing and we're listening to the stories of people. Hopefully we're going to get to the point where we all hope to be.
We want to be part of your village, Alex. So
Absolutely.
We thank you for your time, and every single one of us wishes you improved health as you go forward and continuing your rehabilitation process. So thank you. I also want to thank the IFA team, and in particular Luana and Bruna, for once again, you know, hosting just an exceptional Global Cafe. I wish you well, one and all, and look forward to being with you next Friday, 7 a.m. Eastern Standard Time, to talk with one of my favourite people also, Alex, Ross Upshur. So be well, and thanks a lot again, Alex. Bye-bye.